This presentation is sponsored by the Griffith Allied Health Clinic's Physiotherapy practice, located on Level 4 of the G40 building on the Gold Coast campus. This presentation will explore carpal tunnel syndrome and whether or not this could be the source of what you are feeling. Carpal tunnel syndrome can present in stages. It generally starts with tingling or numbness in the thumb, index, middle, and half of the ring finger during everyday activities such as driving or talking on the phone. This can progress to feelings of swelling, aching, cramping, and grip weakness. Symptoms will usually be activity dependent but can be worse at night or early mornings. Commonly, affected people will wake during the night with symptoms and have to shake their hand to obtain relief. The carpal tunnel in the wrist is formed by the bones and ligaments on the palm side of your hand. This allows structures such as tendons and the median nerve to travel through this space to get from the forearm into the hand. In total, 10 structures pass through the carpal tunnel, and as we move our fingers and wrist, these slide and glide, lengthen and shorten, allowing us to move our hand however we need to. Most of the time, carpal tunnel syndrome happens spontaneously and can affect everyone differently. It occurs from an increase in pressure or a decrease in space of the carpal tunnel, which places pressure on the median nerve. When a nerve is placed under compression, it can alter the transmission of impulses through that nerve, leading to altered sensation acutely and weakness in the long term. Factors such as age, gender, and the structure of the wrist can have an effect on someone's chance of acquiring carpal tunnel syndrome. This is most frequently seen in middle-aged females, but can affect people of any age or gender. Other factors, such as manual work demands of the hand and wrist, vibration, cold, pregnancy, diabetes, and smoking, have also been associated with carpal tunnel syndrome. It is important to note that your symptoms may not be coming from the carpal tunnel. They could be arising from compression of a section along the path of the median nerve in the arm or neck. Your physiotherapist can help with distinguishing the origin of these symptoms. Determining the cause and contributing factors is important to the management of carpal tunnel syndrome. Your physiotherapist will diagnose carpal tunnel syndrome based on your patient interview and use tests such as Phelan's or Tunnell's that examine the role of the carpal tunnel in relation to your symptoms. They will also examine your neck, upper back, and the mobility of your nerves, and may also use specific questionnaires that can aid in determining your current functional level. Physiotherapy is beneficial for most carpal tunnel sufferers, especially in mild to moderate cases. Your physiotherapist will work with you to educate around self-management, including activity modification, awareness around aggravating positions, and relative rest. Splinting is an inexpensive way of controlling movement at the wrist. It can be particularly helpful for nighttime waking by keeping the wrist in a neutral position while you sleep. Exercise and manual therapy can focus on the sliding and gliding of the median nerve and tendons that pass through the carpal tunnel, increase the range of motion at the wrist, and fine muscle control of the hand to ensure that you have the best strength and movement possible out of your hands. The Griffith Health Clinic's team of physiotherapists are experts in assessing, diagnosing, and treating musculoskeletal conditions. If you are experiencing hand discomfort, please book an appointment with our friendly team to begin the management of your condition.